I'll hand things over to our Senior Vice President of Industry Solutions at Quisitive and our moderator for today, Syed Fahad.
Thank you, Courtney, and welcome everyone to joining this webinar. We are very excited about this panel webinar. We have some of the greatest minds in the industry joining, who each bring a unique perspective and unique experience to this important topic. We promise this is going to be one of the most valuable hour you spend this week. I'm going to start with Ruby Knight as my panel introduction. Let me introduce Ruby Knight, who leads the healthcare industry strategy for Quisitive, with over 20 years of experience, starting with Baptist Health, Microsoft, Accenture, VMware. Ruby expertise really lies in understanding of the healthcare business and then how technology can drive optimization. Next, I'm going to bring Dr. Christian Viet. Christian is a practicing orthopedic surgeon and serves as the Chief Technology Officer at Arthur Health. Christian has a unique background as a surgeon and expertise in healthcare, but also means understanding the technology at a different level. And he has been advancing value-based care model and leveraging digital solution to streamline healthcare delivery to improve patient outcome. Christian and Arthur Health have been great partner for Quisitive and Microsoft for years, and I look forward to him sharing his experience with you. And then last but not least, Ian Morrison is the National Director of Data and AI for Microsoft US Health and Life Sciences team. In his role, he focuses on driving AI and data solutions that address critical challenges in the healthcare and life sciences industries, leveraging Microsoft technologies to enhance care delivery, improve patient outcome, and streamline operational efficiency. Welcome, everyone.
Thank you.
Thank you.
I'm going to start with my first question really lies around every time when we connect with our customers, especially in healthcare space, either they talk about the hype of AI and what they believe can do, or myths surrounding generative AI and the impact. So I'm going to start, my first question, Ruby, with you. What are the biggest myths surrounding generative AI in healthcare today that you've experienced?
Yeah, sure. Thanks, Syed. Hello, everyone. There are some reoccurring themes, and I would say the biggest one that I've encountered has been AI will take clinician jobs away. And interestingly, talking amongst peers, we term AI as being a business tool, a collaboration asset to clinicians. And the idea that AI is intended to inform and not make decisions, to me, resonates in the sense that clinicians will always be the center of patient care. So that would probably be the largest myth that I see circulating.
Definitely. Ian, do you have a point of view on this?
I do, and I love Ruby's point of view. And we're actually seeing a lot of reinforcement from early adopters of AI that they're able to focus on higher level tasks if you're a clinician, and in even in other areas where we're introducing automation, folks that have been in those roles that are in essence getting automated are actually able to contribute to higher level functions within the organization. So we are generally not seeing jobs being eliminated, to Ruby's point. I think the thing for me, two things really quickly that I hear the most. The first is that generative AI is not safe for use in a healthcare context. I think there's a lot of fear, uncertainty, and doubt out there. You can't go into a tech journal or LinkedIn without seeing, horror stories. But the reality is that it's happening today, and there's been a lot of organizations that are already successful here. And there's a lot of controls you can put in place to make generative AI safe and effective in clinical use. And the second thing is that I think there's a perception that driving value with generative AI takes a massive investment, huge teams of specialized resources, and long time to create value. And the reality is you can start very quickly, very small, and get some amazing wins. And we're going to talk more about that a little bit later on.
Thank you, and I will echo the same thing. I heard from so many of our healthcare customers that believe that AI will take a large amount of data and make large amount of decisions without people in the center. And means the key driver is that humans are always a center in any of the AI initiative or AI design, and that really creates a great momentum. Christian, you being on the both side where you have been recipient as a provider of some of those, means questions and myth, and then being technologist at how you're enabling. So what's your view on the myths?
I think, Ruby and Ian have hit on a couple of the biggest myths. I certainly feel that my job as a surgeon is safe, at least until I retire. As far as AI replacing me, I think that it definitely has the ability, and I would encourage people to look at it as a tool to augment their thinking, take you to those higher levels of thinking, uncover some of your biases that you may have, as you approach clinical decision making. But it has a lot of difficulty, replicating empathy, compassion, certain aspects of critical thinking, some of the decision making that goes into the relationship part of building a relationship with the patient, and gearing your decision making around that. I think another big myth is that it's going to actually make healthcare more expensive, and certainly in Canada, we're kind of capitated in various models, and people are kind of looking at it and saying, well, I don't have the budget. But if you look at the overall potential, while it may take an initial investment to get certain things or pilots up to speed, it has the potential to greatly reduce overall healthcare costs. And for the most part, that's by improving efficiency, reducing errors, unwarranted variability, which is a huge one in healthcare, and early disease detection. So if you can detect diseases earlier, then by all means, you can hopefully prevent the higher costs associated with overall care. So I think those are kind of some of the big ones. And then the last one I would just touch on is, kind of the bias, or that there's an inherent property of bias and lack of validity in the technology. And I think a lot of that stems from the fear that, it's a little bit of a black box at times, and you kind of don't know exactly what's going into making that decision. And so I think as we start to kind of be a little more open as far as how those decisions are being made with the various tools that we're using, we'll start to uncover, or start to basically understand and realize that it can be that tool to augment our thinking and how we approach different decisions.
Absolutely. And, some of the good thing about myths are that it spark conversations, and that really help us progress in our thought process and thinking that how do we move. So I'm going to switch a little bit out from myth, more into hype or promises, because while there are challenges always comes with some of the new technology, I'm sure that there are, means areas, or I would love to hear a little bit more about what are the most promising applications or use cases of generative AI that you're seeing in healthcare today. I'm going to start with Ian. I'd love to hear your perspective.
Yeah, thanks, Ed. And so what I'll do is maybe just describe in a few categories of some of the use cases that we're seeing, and I'll also asterisk, right? Like, these are real things that are happening today. These are not aspirational use cases, but they are things that are being actively applied using generative AI and other augmentative AI capabilities in healthcare. So the first within our health providers, I think there's been a tremendous amount of focus around clinician burnout. We all recognize this as being one of the most acute challenges we face in the care delivery system. So all of these use cases really go to the core of how do we make the clinician's life easier, reduce error, and ultimately result in a better patient experience. And I would say the top use case here that is rapidly taking hold is around ambient scribes. So this is the use of AI technology in an exam room where a clinician's meeting with a patient and AI is recording the conversation, making intelligent determinations about what's happening, eliminating superfluous information, then ultimately generating a note that the clinician can then, edit or approve before it goes into the electronic health record. So this is very, very popular right now. A lot of health systems are going all in on this. both for physicians and nurses. Other things, that I think seem kind of obvious, but some people are often a little bit concerned about things like chart summarization, right? EHRs are notoriously bad at having clean and accurate data. There's a lot of duplication. There's a lot of error. And so generative AI actually does a fantastic job of simplifying, consolidating, and highlighting salient points from a patient's clinical history in a summarized note. So and that has a lot of downstream applicability. Other things I'll just make note of, things like surgical planning, discharge planning, and one that's become very popular is patient handoff, right? So all of the data analysis that takes place as a patient goes from, let's say, the ED to an inpatient setting, generative AI can be very, very effective in simplifying and reducing the time associated with those handoffs. So that's more on the clinical side. I would say then on more of the operational side of things, assistance with things like medical coding is starting to become more prevalent. Anything around prior authorization, appeals management, very painful, time-consuming, laborious process that requires clinicians, to be involved in those, that takes them away from the true work that delivers value. There's been a lot of focus there. And then other things like revenue cycle and fraud, waste, and abuse are very common. And that, again, that's more of the provider side. Within health plans, I think contact center was probably one of the first and one of the quickest areas we saw a lot of momentum in terms of call summarization, even assistive capabilities to guide customer service agents or member service agents through a conversation. And then anything around unstructured data processing. I was with a payer yesterday, and their chief technology officer said, anytime a human being is responsible for taking a fax, PDF, email, or paper document and making sense out of it, that should be something that's done with AI. So a lot of focus there. And then, of course, they have the other side of prior authorization, and that's a little bit of I would think sometimes a struggle between the payer and provider, but a lot of work happening there. And then, lastly, pharma and life sciences. There's been a ton of activity around anything that accelerates drug discovery, from literature review to precision medicine, genomics. There's been focus on training sales reps and doing simulation within the field sales representatives, certainly clinical trial management, and medical documentation. So many other use cases there as well. And then lastly, I'll just say there's a bunch of ubiquitous use cases, right? So the idea that you can chat with your own data, whether that's HR or policies, contracts, those types of things. And then, of course, co-pilots that assist with everyday tasks, from managing meeting notes to drafting emails to doing data analysis. So I mentioned a lot there, but just a quick tour of some of the things that we see most commonly.
Oh, absolutely. And very, very interesting. I think, Ian, what you're saying is that AI is real for healthcare.
It's real and it's everywhere.
and it's everywhere, right? Every time we talk to customers, there's always, when it comes to healthcare, optimization is the next important thing for any healthcare organization. It seems like AI is driving that momentum for many of these customers. Christian, you mentioned, seemed like your job is secured. AI is not going to take it. But what you are seeing from real-time experience in the value that AI is delivering to your organizations and organizations you're working with.
I'll give two or a couple of different examples. I think kind of put on my division head hat here at the hospital. We have quite a large arthritis intelligence, which obviously is AI as well, but we have a large arthritis intelligence group that really is looking at novel drug candidates for arthritis, and there's just a whole incredible amount of value that comes from being able to do the analytics on these large, whether it's whole genome sequencing, whether it is protein or other interactions. That's really driving some of the novel discoveries that our team here at the hospital has come up with. Another really fascinating area that our AI hub has basically just kind of brought into a clinical trial or into a trial is identifying risky kind of areas during laparoscopy. And although I'm an orthopedic surgeon, I understand, there's certain areas that you don't want to go when you're doing a laparoscopy. And so using, kind of the augmented reality tools and understanding and image analysis, they've been able to highlight this area that you really want to stay away from when you're doing a laparoscopic cholecystectomy, as an example. And so the whole idea is to improve the safety of that actual training. So these are some areas where I think there's an incredible amount of promising applications. On the Arthur Health side, and when I look at my chief technology officer hat, a lot of our world is about predicting, and predicting which treatment is going to be best for that specific worker or patient. And so being able to utilize and incorporate that into our care paths so that we can flag to our clinicians that, this patient has a specific score, they would really benefit from an early assessment for mental health, as an example, I think is an area that we're spending a lot of time and investing in heavily, because it seems to have the, when you look at the upside of getting that care earlier, it ends up saving so much, not just saving money, but actually returning that patient or worker back to living so much faster. And that's really one of the key things that we do. The AI scribe is taking over. I just read an article this morning that one of our hospitals in Toronto here has been piloting it, and a modest impact, 10 to 15% as far as their efficiency, seeing 3 to 4 more patients kind of in a shift. But that's real, and I think that it does decrease that time to the time spent on notes. Of note, though, you can't just set it and forget it. You have to review your notes. There are multiple situations and publications, whether it's in law, in legal, or whether it's in healthcare, of information being essentially present in your note that wasn't actually said. And you definitely have to take that time and invest in educating the tool itself, but make sure you do your due diligence, and that the information that it is putting together into your template or note, is real.
That is so true. And that's the point. The reality is that AI will not magically take every workload off from your plate, but AI can enable you to do your work in a more efficient and optimized way, right? I think, Christian, what you started with is that AI is not something new, right? The genome sequencing and prediction on modeling and other thing has been there. What I'm seeing more and more is that leveraging generative AI to remove mundane work, like the example we had, what we work with, where physician has to spend 30 minutes to take all the notes and put it into a Word document and share with someone, how AI can actually do all that work in few seconds for you. Save 30 minutes of a physician time is always great. It doesn't mean that we remove the burden of reviewing the information. That has to be there. But AI is definitely helping in kind of assisting you doing your job more efficiently. So Ruby, just purely from what you are hearing from your customers when it comes to the most promising applications in generative AI.
Yeah, I think Ian and Christian really summed it up well. In projecting on the clinical side, I would say there's a lot of upside on the operational side of the business as well. And this is what we're hearing from customers. And Ian, you mentioned earlier about clinician burnout. We've made so much progress in this space that not only have we been able to address clinician burnout through some operational use cases, but we have verbatim back that says when care worker experience increases, so does patient experience. And that's what a lot of our customers are saying today. So I'm excited about it. all of it. I'm particularly and personally excited about precision medicine. So I love that we're already making traction in that area, and I have some predictions that I'll share at a later time. But I'm really excited about the revolutionary impact that AI will have on healthcare.
Great, thank you, Ruby. Like we all are excited about what is possible with AI, right? But whenever there is a new technology comes up, whether it was a mobile era or everyone moved to the cloud, and now today in AI, there's usually comes with challenges how to operationalize some of these technology in the best way, right? Christian, I'm going to start with you, both from Arthur Health perspective and also you being, physician and surgeon. What challenges do you think that hospital and health systems are facing to integrate AI into the workflow, right? And the reason why I'm bringing it, that's always a centerpiece that you already have, in some EMR platform or some other platform where you're performing action. What challenges do you believe or do you feel like that organizations are facing integrating with AI into their existing workflows?
Yeah, thanks, Ed. I think it's definitely a vast question. I'll start off just kind of, where a lot of, if you look at kind of the tiers of where people and organizations often are in their evolution, kind of data sources integration or their data architecture, many have moved on to consolidated platforms. So they do have data represented and kind of less siloed, but often still data is siloed quite significantly. The tools are really only as good as the data quality, kind of at the source. And so, you need that high quality labeled data for any type of training that you're doing or building out any of these tools. You have to have a team that, understands, the best ways to utilize these tools and put the clinical view on top of it. So I've done some projects where we've had data scientists go to work and it's great. They come up with something, but from a clinical feasibility perspective, it doesn't kind of pass that, pass that test. And so we've had to kind of look at, kind of integrating the data scientists with the clinicians to make sure that there's a, that kind of dyad approach. So I think, that the data source and integration is a big piece. One other, another area of challenge, I think, is, and we have a whole ethics team at times in looking at ethics and patient trust. I hit on it a little bit before. Many of these deep learning models are black boxes or seem like they're black boxes. Understanding how the tools arrive at the conclusions to trust its recommendations. And I think that as we move on, we're going to have a better understanding of how they're working, and transparency to decrease some of the skepticism that hinders adoption in these tools. That being said, there's lots of literature out there that if you look at, different levels of clinicians and their diagnostic accuracy as an example, often, the diagnostic accuracy is only in the 50 to 60%, range for, upstream, clinicians. When you start looking at patients kind of in their trajectory and coming into specialists. And so I think we need to kind of take a step back and understand, what we're holding the AI tools, what level we're holding them to as far as their accuracy. A lot of the bias and fairness side of things, making sure the tools themselves are representative of your population, of your actual patient, cohort that you're looking to utilize it in. The whole data privacy and security side of things. Obviously, hospitals have a highly sensitive, patient data, and you have to make sure that these tools have walls and containers around them, and your data is not being sent off to to be analyzed in a different country that then has some issues with your local jurisdictional privacy laws. And lastly, informed consent. So if you're going to utilize these in with your patient, do you need to obtain informed consent? and meaningful informed consent. What does that look like? What does that look like with a patient when you start using AI tools in clinical care? I haven't actually done that in the clinical context where I've had to get informed consent, but as we look at probably moving into some of the ambient scribes and various scenarios, I think that's we're going to have to get consent in many of these different situations. Obviously, change management is a huge area. Resistance to change. My workflow is fine. I don't need any optimization. I run my clinic. I do a great job. I'm done by 4 o'clock. Leave me alone. Okay, so we hear that all the time, and I think that by and large, we've figured out ways to get pretty darn efficient. And I think that there's some areas where there may not be the rationale to try to leverage these tools, right? But certainly at larger operational areas, I think you can start driving certain areas of change with these tools, and we've kind of utilized it to kind of look at return to emergency department and how we can predict those patients so we keep them an extra day or two, or get them into rehabilitation rather than them coming back to the emergency department. And optimize some of those care pathways. And then I think one of the other last challenges, I think, starting to kind of rely too heavily on AI, and are we going to start seeing some of the loss of human touch that that I talked about earlier, if we start relying too much on on technology, and unforeseen errors. I mean, there's a whole new area opening up where from a hallucinations perspective, or I mean, it's very difficult at times to pick up, especially when you're doing it at large scale, what is real and what is not. And I think that we're going to have to put things in place to essentially be able to analyze these tools, but how fast they are able to process, trying to analyze whether what they're doing is real or not, becomes very difficult.
Very, very informative. Thanks, Christian, for the feedback. And I agree that many times when we get into these use cases, we think about that how would we kind of cure cancer, and AI definitely at some point will. But many times picking up a smaller use case in IT or HR and other places could be very useful. Ruby, I'm going to ask a quick question to you and then to Yan. I know, Ruby, you are right in the middle of many of our customers going through this. What's your view of number one challenge organizations are facing to operationalize AI?
Yeah, so Christian touched on, the important parts, and I would say integration and interoperability. But, even outside of that is how do we safeguard this new realm of information that we are looking to leverage? So I think with the way that we have options around how we structure our start to AI, I think that we can help to kind of reduce some of the angst that comes with, beginning this journey and overcoming some of these challenges. But when we're dealing with large monolithic systems, it's difficult and it can be quite daunting, quite frankly. So, but I think Christian touched on the big pillars here. I think if we can solve some of the areas around interoperability and integration, we can access and unlock the value in some of this data, whether it be unstructured, semi-structured, or structured. So that's my thought on that, Syed.
That's very good. And looking from Microsoft lens, what's your experience on some of these challenges?
Yeah, I think Christian and Ruby did an amazing job of hitting, the bigger points. I would maybe just reinforce how important culture is to success here, right? Because you can't just let the tools, be the tools, right? Whether you're taking something out of the box from Microsoft or Epic or whomever and applying that in your environment, or if you're building something on your own, you've really got to have very high level organizational commitment to success. The customers that I've seen be most successful, the chief nursing officer is sitting with the teams that are doing a hackathon, coming up with an MVP, and ultimately carrying that forward to break down the barriers of adoption in that last mile of clinical workflow. So, yeah, again, I think just culture is so important. And then, it it's not a one and done. You can't treat this like we've treated IT projects of the past, where it's this thing, we work through the phases and we're done. This is very much an iterative process where you've got to continually reevaluate what are you going to build versus buy, where are you going to invest, how are you measuring ROI, and ultimately, how do you accelerate the adoption in the organization to achieve your high-level goals?
Great, thank you. I know means this year, many healthcare organizations are everyone is trying to understand really the impact. There are great use cases, means our panel has talked about. As we are getting into the 2025, I think many organizations are getting to the place where they have a higher level of confidence to let's go and start applying some use cases. Let's go apply some AI into the workflow. What would be a recommendation? Ruby, I will start with you. What is your recommendation to those leaders that how they can get started, and then how they can make sure that what they're starting with are scalable and sustainable and be able to drive a value for them long term?
Yeah, so we have a number of programs and resources available to help organizations begin or accelerate their AI journey. We partner with Microsoft and the AI Lab, and we have an innovation center, and I know we'll hear more about that. But when I think about where we start, I think mindset, Ian mentioned culture earlier, but mindset is also important here. And this is probably where we actually want to think in a modular way and start to evaluate high value targets within our organization, whether that be on the clinical side or the operational side. We know cost is always a challenge with these organizations. So in some regard, looking at where we can create operational efficiency is fantastic. But where we really want to begin is building a catalog with a balance of feasibility and strategic value, and begin to map out how that looks for us, because each organization is going to have a different set of priorities and goals that wrap around the use cases they identify. And then once we do that, obviously things like our data equality and feasibility, things like that will come into play. But the first step is really to look at, where do you want to implement AI, why, and is there a high value, and is it feasible? So once we do that, I think we have a good roster to begin, kind of incorporating some of these concepts within our organization. And some people, to empower implementation, actually leverage a sandbox where they bring in their clinicians and allow them to be part of the change. And in a safe arena, they're able to try out these use cases, one with either their own data or different processes or existing workflows. And one thing that does is it allows them, the person that is actually engaging in the sandbox, to ask AI to create the use case for them. And then they can take that to IT. So there are a number of different tactics that we can leverage to begin the journey, and even resources if you're not comfortable with doing some of these things on your own, or both. So that's my initial take on it.
I like the idea of using AI to come up with the AI use cases. I think that's great. And I know you have worked with many organizations this year to actually help them get through this journey, right? So if there are CMIOs, CNO, CIO, or physicians, providers, and healthcare givers are listening to this conversation, what is your recommendation that how they can get started and ensure a scalable, secure, and sustainable AI platform?
Yeah, I think that the first thing, and Ruby touched on this, right, is making sure you're focused on the right things. It's very easy for everyone to get excited. Most organizations I talk to have dozens, if not hundreds, of use cases in the backlog that are coming from all over the organization. But the things you start with, right, have to be connected directly to the strategic imperatives of the organization. And I suggest oftentimes look at the CFO's office first, right? How are we doing on some of the financial measures and metrics, right? How are we looking on KPIs and OKRs? Where are the areas for improvement there are often great places to start. How are we doing on quality and safety metrics, right? So those can be really obvious places to get started. And then the second thing is look at your strategic vendors and where AI products are already being created that you can rely on and trust. And I'll just give you one example is in-basket management that Epic has started to deliver within the EHR, right? So if you're an Epic shop, that's something you should be rapidly adopting versus going out and building or waiting and seeing. Like if you're standing still these days, you're falling behind. So, I think for a lot of leaders, it's you've got to start, focus in on the subset of vendors you trust, be cautious of the myriad of health technology vendors that are now AI vendors. You have to be very cautious about, how you accept and use their models. But you've got to start somewhere. And again, if you're building something on your own that you've decided is high value, to Ruby's point, rely on, partners, rely on your vendors to help you do that, because there's lots of ways to do it safely and effectively that may not be obvious to you if you're just doing some initial exploration.
Makes sense. So, Christian, Ian message is that if you're standing in line, you're getting behind. Waiting is not an answer here, right? How Arthur Health or the customers that you're working with are applying or enabling AI to make it really a sustainable and long-term solution? What's your experience look like?
Yeah, I'm a big believer in, just you don't necessarily have to have it perfectly right, an iterative approach. You got to put safe boundaries around it and the security and safety, but we started, and as you're well aware, we did a pilot, using the Quisitive Fabric accelerator, essentially leveraging, kind of our data sets and data architecture along with the technology, architecture that we put in place through that, and then we weren't kind of set up initially. We had to transition from a different, BI tool and migrating. We were migrating into Power BI. But once we got it kind of aligned and got the, kind of the all the data entities and stuff in the right place, I was incredibly pleased with just the speed essentially of how we were able to start to get some real world, kind of use and answers, being able to leverage it and essentially put Copilot right on top of our already pre-created, dashboards that we had, query our data in ways that kind of we hadn't. So that to me was an area that I think, and I think we put not a true white paper, but we did kind of publish our experience on that. But I would encourage people to start, kind of in that type of, a smaller scale, have good data, really good data set that you are comfortable with what is there. Put your technology and your scalable technology, and obviously, there's a number of different providers from that. I have my personal biases and where we've invested, and I think that it allows you to turn things on and off, increase your capacity, as you scale, make sure that it's locked down from a security and tenancy perspective, so that you can have your data centers where they need to be from a privacy compliance point of view. And then you can grow, and as you continue to uncover and implement, all of a sudden, you start getting suggestions from, people that are early adopters, and then as they start coming on board, and it starts to kind of go across into your other clinicians or operational team, they start to say, hey, could it do this for me? And that's when you really, I think, know that you've started to get that engagement, and get some early buy-in, and that's where you really want to try to drive some of these programs. And I think Ruby
Absolutely.
hit on it early. Find those high value areas, start off with them, but make sure you have a good data set and that scalable technology to kickstart that pilot project.
That is great. And Christian, I remember when we had this big aha moment in our little use case that we were driving to identify that how much information we knew about that patient, which was unused, was in some paper or some PDF or somewhere else, and been able to identify the care gaps through it. That was mind-boggling for sure. But what I'm hearing from the team is that number one, start small. Make sure that we're starting small. We pick a platform so we are not inventing AI again. And then we target high return or high value targets in those use cases. So we are not just busy, we are driving actual value to our user base and the organization. I know we can carry this conversation when we talk about use cases, when you talk about successes, so we can go forever, right? But we do have a limited time. I would love to hear in your own perspective that when we think about, or if I can ask, what is your prediction that how will AI shape the future of healthcare over the next decade, right? How is going to create or transform the way we think about healthcare today? Ian, I would love to start from you.
Yeah, I'll try to be brief. So, my passion for being a part of this industry is really centered around the patient, right? And I think there's so much potential to establish more trust between the patient and the care delivery system, and putting patients really in the center of their own advocacy. And I believe AI is going to help us do that, right? Like I imagine, in the not too distant future that I can have a personal health agent, right, that is responsible for everything from, proactive care plans to mental health and behavioral health issues, and helping me interact with how I receive care in a much more efficient and personalized way. So I'm really excited about the potential there. I think, the ability for those types of advancements to help us get at chronic condition and disease management, that's such a burden on not only health quality, health equity, and certainly the healthcare system in terms of cost. We're going to see improvements there, and ultimately, it's tough to predict what the technology is going to do. But I think if we keep the patient at the center and look at some of those outcomes, the best is yet to come.
Great. Ruby, what's your lay of the land?
Yes, I think I'm going to push on what Ian said. My prediction is that, in the future, what we'll see is more time returned to the clinicians to offer a higher level of patient care. And that could be in the form of AI bringing, wearable information to the forefront. The doctor no longer having to scribe and take notes and just be very focused on building a relationship with the patient. So that's my prediction. I can't wait for that to happen.
Great. Christian, it's my not prediction, but my personal hope is that if there is an AI which can run cardio on my behalf, so I don't have to get on treadmill, that's the future I would love. But what's your prediction for the future?
A couple of different areas that I think will take place before kind of I retire. But AI-powered precision diagnostics, I think, on the enhanced imaging side of things, moving beyond kind of anomaly detection into, actually, predicting either fracture risk, implant wear, something that is, kind of true to my profession, or personalized kind of healing trajectories. I think we'll start to see that. Pull up x-rays. I think we're going to start to see the angles and stuff already, calculated on my x-ray. So I don't have to go drawing them, right? So I'd love to see that. And I think that there's kind of a couple different groups that are starting to look at that, improving our efficiency on that, and tying that into best practice as far as management. And then that cycles through into the personalized, care strategy and care plans. Which, from an Arthur Health perspective, is what our entire company is about, is really personalizing that entire, care pathway, and, not making it so that it's linear. Most healthcare trajectories are linear. you see family doctor, you get referral, and then referral or treatment, and then you kind of circle around and back and forth and play ping pong in the system, and then you finally get to where you need to get to. And so I think that, being able to get that awareness of where that patient is best managed earlier is going to lead to a lot of overall value in the healthcare system. Within our hospital, the whole predictive analytics, we're starting to look at genetics, lifestyle activity levels, predicting risk of arthritis, but also looking at different types of strategies and which patients actually benefit from certain types of orthobiologic injections or certain types of surgeries. Who needs to have some type of augmentation or adjuvant management before they have their knee replacement, as an example. So, because we know that a number of patients have, a high percentage of patients who have knee replacements don't actually get the outcome that they ideally want. Robotic assisted surgery, I definitely will see that in my lifetime. We're already using robots as far as to assist with surgery, but being able to decrease that unwarranted variability that occurs, and then you're gonna our entire operations from the perspective of efficiencies is going to be changed with as we start to incorporate AI tools, optimize scheduling and resource allocation. We're already seeing that. Another big area that I would like to see, and I'm hoping that comes more predictive type of maintenance. Whether it's equipment, predicting failures, how can we make sure that these events basically don't happen? So minimizing disruptions within the surgical, kind of the surgical workflow and surgical continuum, because there's nothing worse than when you're going to try to do a surgical procedure and your light source all of a sudden is burnt out and not working, or there's some other problems and another instrument is not working or hasn't been processed, right? So I think that the predictive maintenance is an area that I'd like to see improved.
Absolutely. No doubt, we're excited about that future and how, especially in healthcare or because of healthcare, is going to impact all of our lives and our loved ones' life in a very different way, right? So looking forward for some of these inspirations to become true. Thank you, everyone, for your insight. It was a great dialogue. I really appreciate and enjoy the unique perspective came from each of you. So once again, thank you very much. I'm going to move into a little bit of a Q&A, segment to see if there are questions from our, webinar attendees. One of the questions that I saw earlier, which is very interesting, and I think I was highlighting that many times when you think about AI, we directly gravitate towards that can it resolve cancer and can it resolve bigger challenges of the healthcare, right? But where we're seeing more and more value, that how AI is enabling IT organization to do delivery better, how AI is enabling human resource to be able to effectively engage with the providers and drive value. So really the question is, in what way you are seeing healthcare adopt AI in their IT department, right? So Ian, I'm going to start from you, and please feel free others to join in the conversation.
Yeah, thanks so much, Syed. And Brian, I saw that question pop into the chat, and I love it because, one of the things I think a lot of intelligent organizations need to start thinking about is how is AI going to affect the skills trajectory, within the organization, whether that's in IT or elsewhere, right? And we're already starting to see an impact here. And just a couple areas that stand out. I think one is around security, right? Security data is almost in a way like healthcare data. It's fast, it's messy, it's often difficult to interpret by humans. And so I think the ability for AI tools and technologies to help summarize, to help find anomalies, to detect things within the stream of the security data that's coming out organizations is very, very powerful. And this is only going to escalate. Like, I don't believe that you'll be able to do security effectively without AI augmentation in the very near future. So that's certainly one. And then, just, I mean, the basics, like generative AI is incredible at writing code, right? Whether that's writing SQL or Python or DAX, right? So that's a really powerful capability, which is allowing business users and people that have never been technically trained the ability to interact with systems in a way that they never had before, right? So in a natural language way, I can ask a reporting and analytics solution to generate a chart or analyze data for me, never knowing the underlying query technologies or languages or syntax or any of that. So I think that's incredibly powerful. And much more to come here, right? Just this idea of intelligent systems where you can do a lot of IT operations just through prompting, right? Is where we're going to be very, very quickly. So love that question. I think that's an exciting area of innovation right now.
Thank you, and there are a lot of similar questions that people are asking, and what I would recommend that please reach out to our team, and I'm sure that the panel will love to answer some of those. And I'm going to just keep you on the point a little bit more. We have heard about myths, we have heard about use cases, we heard about the challenges. We'd love to hear Microsoft perspective and how Microsoft is kind of providing technology tools, partners to help enable healthcare organizations to be great in AI.
Yeah, thanks, Syed. So, really quickly, I mean, I think it's a lot of organizations, think of Microsoft as the Office company, maybe the Azure company, right? Probably familiar with the concept of co-pilots, where we're bringing those AI capabilities into all the tools that people know and love and use every day. But there's a lot of work happening behind the scenes in sort of the all-up ecosystem of tools and technologies that Microsoft develops that is specific to healthcare. So if you look at the sort of the stack on the right side, right, from the base layer of security, all of the infrastructure technologies that we build from Windows and SQL Server to everything we do in Azure, all of the data platform capabilities. You heard Christian talking about Fabric and the myriad of AI services and our partnership with OpenAI, up through how we enable organizations to build applications, deliver capabilities through our modern work platform, business applications, and then clinical applications like Nuance. At each level here, we have dedicated engineering organizations that are building healthcare-specific capabilities and working on healthcare-specific partnerships. So things like partnering with Epic, things like building health data services to enable interoperability with the data platform, and ultimately even building new technologies and capabilities in teams to be used in a clinical setting. So again, I think just wanted to just briefly illuminate how committed Microsoft is to the healthcare industry and how much innovation is actually happening in all of the products and services that we deliver.
I always say I always thank Microsoft for their generous investment in OpenAI or generative AI, which opens up all of these great scenarios and use cases. I've been working healthcare organization for 20 years. And this is, I can tell, this is the best time to be in. What really we are doing and working with Microsoft is bringing some of these, or put a structure around some of these concepts we talk about, use cases, and identifying which use case is the right use case and which use case is going to bring you a better value. Put a whole structure around working very closely with Microsoft to make sure our customers has a structured approach to leverage Microsoft technology and generate and deliver use cases, right? Not only that we have the structure to create new ideas and brainstorm ideas, but we're also coming up with a lot of pre-built use cases on Microsoft platform to ensure that if there is an idea about Scribe, if there is an idea about payment integration on the case identification, or there is an use case around, generating a new or provider level service chat, we kind of pre-built both on what value and what feasibility is available and drive from there. We're kind of creating the whole agentics framework around driving some of these use cases. So when you get a patient referral, I think, when somebody says, We don't want people to be scanning a paper referral and try to interpret it, right? With new agentic frameworks from Microsoft, you're able to bring those referral, automatically drive into prior authorization, create a new registration case and intake process without more of a human involvement. You can get from referral to a patient scheduling, through a complete automation process. So that drives a lot of value. End of the day, means there's a great webinar we did, means last week. I would love to have you take a scan of this video and run through and hear about how Dr. Nizar and our guest panelists have explained that they're leveraging AI to transform patient care. Means end of the day, our focus is really around creating a AI integrated care delivery organization. Whether you are in a preventive care, so we avoid getting you to the hospital, or in the episodic care, that if you are in hospital, how AI can enable. And in a chronic care, once you're outside of hospital, like the example of knee surgery you have explained, Christian, how do we drive more and more success and efficiency from there, right? There is a 100% funded, free funded, capability or a offering available from Quisitive and Microsoft, which can allow to any qualified organizations to leverage everything I explained, from identifying the use case from AI Innovate, or leverage some of the use case we have pre-built in your setting, in your environment, and drive some efficiencies from there. So please scan or ask at quisitive.com, reach out to get benefit from it. We are going to reach out to you directly to ensure that that you get your reward. But end of the day, I really appreciate everyone joining. Thanks again. I hope you enjoyed, and I hope that you find this time as the greatest hour I've kind of said in the beginning. We are available, means to help you through this journey of AI. We have helped many customer transition from means in the mobile era. We have helped customer transition to a cloud era, and it's just not about the technology, the process, people, and the love of technology we bring for healthcare. So looking forward to kind of connecting with everyone, and please feel free to reach out to us to get started with your AI journey.